Hello everybody, my name is Dr. Justin McCormick. Today I would like to talk to you guys about headaches and migraines. I have treated literally thousands of patients over the last decade with headaches and migraines. And now, with a new revolutionary technology and treatment that we call brain-based therapy, our results, they're astronomical. A typical patient will come into my office suffering from either the classic migraine headache, which is where they have the prodromal phase, and that's the aura or the squiggly lines in their eyes, which is typically followed by 20 to 30 minutes later by a full-blown migraine that may last 1 to 3 days. Or they'll have the common migraine headache where they just don't have that prodromal phase. But either way, they're always telling me that these migraine headaches are robbing them of their lives. They're taking away time with their family, their friends, their work, and it's a sad thing to hear that these have been going on for so long. So I'm really engaged at trying to help these people. Now, most of them have been on medication. Okay, they'll come in with either drugs or anti-seizure medications to cover or mask the pain, but initially they'll tell me they worked very well. But then as time goes on, it becomes less and less effective to where they're just not working at all. So our standpoint is not just to cover that person's light sensitivity, nausea, vomiting that they're having, the sharp stabbing, throbbing pains that they're having. It's not just to cover it with more medication. We're trying to actually correct the problem. And as I said, we use what's called brain-based therapy, and essentially that's addressing the problem and the condition from a neurological standpoint. The problem with these people is their brainstem, it's not working. It's where we classify as over-firing. It's working more than it should. And the brainstem that I'm talking about is this area right here. We call it the upper brainstem or the mesencephalon. Now, what causes that to overfire? In nearly every condition, it's some form of stress, and that stress may be emotional stress, it might be a physical stress, sometimes it's a chemical stress, but either way, that person's body secretes an abnormally high amount of cortisol. Now, the problem with cortisol, that's released from the adrenal glands above the kidneys, but anyway, cortisol is toxic to the brain. Now, the way that your body should work, okay, is messages should go from this area of the brain down to what we call the lower brainstem, which is right here, which then travel up to the upper brainstem. That's the mesencephalon that I was talking about, and that area then controls and regulates the body. Well, in somebody that has had these prior stressors and cortisol has damaged this portion of the brain, messages then can't go down to the lower brainstem. That will slow down that upper brainstem, and then therefore it overfires. So the most common symptom that we see with a migraine sufferer is, of course, the intense headaches. Well, what causes that? When that upper brainstem or the mesencephalon is overfiring, it causes the blood vessels to expand and contract, to dilate and contract. And that's not necessarily so much where the pain is, that's where that throbbing sensation comes from. The pain comes, that intense stabbing, sharp pain that they have, because there's a nerve mesh that wraps around the blood vessels. So as that blood vessel is expanding and contracting, that nerve mesh is being stretched, and that causes that intense pain. Now, they'll also almost every time have vomiting and nausea. Well, what causes that? This area, again, of the brainstem has what's called the vagus nerve, and that goes all the way down into the gut. Well, when that brainstem is overfiring, it causes your stomach, your gut, to become more sensitive, and vomiting is typically followed by that. The other thing is they're very light sensitive, okay? Their pupils, they can't constrict, so they stay dilated. The third cranial nerve that controls your pupil opening and closing comes from, again, the upper brainstem, goes into the eyes. So in an asymptomatic person, light is controlled by the pupil closing and opening and closing. But in a person with migraines, that doesn't happen. They stay open. So they have to retire to that very, dark room or the area with no light, basically. So those are the three common things, and the reason that we have found that is causing those symptoms. Now, once you get the brain under control and working normally, your symptoms should either diminish or dramatically subside. Now, how do we do that? Okay, well, one of the main things we use is oxygen therapy. Okay, your brain, it needs two things to survive. It needs fuel and activation. Well, fuel comes in the form of oxygen and glucose. We get glucose in the foods that we eat. Okay, so hopefully you're on a good diet. Okay, if not, we need to get you there. But the other thing it requires is oxygen, and most people are suffering from oxygen depletion. We get less oxygen into the body as we age. So we're going to be using oxygen therapy to replenish that. And we use what's called oxygen concentrators, and that delivers 90% or more oxygen into the body. The other thing the brain needs is activation. So we use a tool that we call an activator. It's a small handheld device, and we find different nerves or different areas of the nervous system that aren't working properly. We stimulate those. It's a very light touch. Nobody ever complains about pain with it. It's essentially painless. A couple of clicking noises happen, and that stimulates the nerve to work better, therefore getting that whole brain system that we talked about working better as well. We'll also use what's called laser therapy, and we'll put lasers into different areas of the brain to help that stimulate and heal faster, and that also decreases the inflammation in the brain. We'll also use many times what we call spinal decompression, where I have the technology to open up diseased discs that might be compressing on those delicate and sensitive nerve fibers that are causing or at least contributing to that intense migraine pain. So those are some of the most common things that we use. We obviously use some, obvious things like supplementation, herbs to try to help also control the headaches and migraine problems. So those are the kind of the general overview of what we do. I look forward to seeing you guys soon. Call and make that appointment for a free consultation with me. We'll do everything we can to help you out, I promise. Hopefully we'll talk to you very soon. Thank you for your time.